If you're over 60, 120 over 80 might actually be unsafe for you. I'm Dr. John, board certified in internal medicine as well as geriatric medicine, and today I'm going to show you your real blood pressure target. Let's go step by step, the same way I walk my patients through this in the clinic every week. If you're over 60, I want you to hear this clearly. The blood pressure goal you grew up with, the famous 120 over 80, does not always apply to you anymore. And in some cases, forcing your blood pressure down to that number can actually be unsafe. Today, I'm going to walk you through exactly what your real blood pressure target should be, why blood pressure behaves differently as you age, what the safest target truly is, how medications and lifestyle changes work differently, and what warning signs you need to look out for, and the exact question to ask your doctor at your very next visit. Let's start with why this matters so much. Because once you cross 60, your blood pressure no longer behaves the way it did when you were younger. Your arteries change, your pressure sensors change, your medication tolerance changes, your risk of dizziness and falls changes. Blood pressure becomes a balancing act. Blood pressure in older adults is more about balance than perfection. Too high and you increase your risk of stroke and heart disease. If it's too low, you increase your risk of dizziness, falls, and God forbid, fractures. And you might even experience decreased blood flow to your brain. That's why this matters. We're not chasing a perfect number, we're choosing a safe number. The number that keeps you steady, keeps you healthy, and keeps your body and your mind protected as well. What should your blood pressure be after age 60? This is where most of the confusion comes from, because you've probably seen 3, 4, 5 different answers about what your blood pressure should be after age 60. Let's make it simple in a way that makes sense for you. 2 major guidelines exist. The first is the JNC-8. This guideline says adults over 60 should aim for under 150 over 90. The second is the ACC-AHA guideline. All adults should aim for under 130 over 80. And I know those numbers look very different. No wonder people feel confused. Let's take a deeper dive and compare both trials. And I promise you only highlights so that you can make an informed decision and you won't fall asleep and feel bored. So why are the JNC guidelines so relaxed? Because older adults are more prone to dizziness, dehydration, kidney sensitivity, medication side effects, and falls. The JNC wanted to avoid overtreatment. The ACC-AHA guidelines came from trials like SPRINT, where lowering systolic blood pressure reduced strokes, heart attacks, and cardiovascular deaths. But here's the key. SPRINT excluded many people with frailty, advanced diabetes, and frequent falls, the very people I see in the clinic every day. So the results don't apply to everyone over the age of 60. So which one should you follow? Here's the truth. The safest blood pressure target depends on your health, your fall risk, your frailty, and your medical conditions. Let me break it down clearly. If you're generally healthy and you're active, you're independent, you don't get dizzy easily, you don't have major kidney issues, and you're not taking multiple medications, then your safest target is under 130 over 80. This is where we see the strongest protection against stroke and against heart disease. If you're frail or have multiple conditions, this includes kidney disease, diabetes, neuropathy, unsteady balance, history of falls, a cognitive decline, or polypharmacy, that's a fancy way of saying you're on multiple medications. If that sounds like you, then your safest target is 140 to 150 systolic. In this group, the blood pressure too low causes more harm than good. The simple rule, healthy older adults under 130. Frail older adults under 140 to 150. Not too high, not too low. It has to be safe and individualized. Let me explain why blood pressure changes so much as we get older. This part is extremely important because once you understand it, everything becomes clearer. And I'll explain 4 changes, and these happen when you get older. Number 1, your arteries stiffen. When you're young, your arteries are like new rubber hoses. They're flexible, they're stretchy. As you age, your arteries become stiffer. They become more like stiff garden hoses. They don't expand the way they used to, so your heart has to push harder, which raises the top number, your systolic pressure. This is why older adults, you commonly see 140/72 or 155/68. This is called isolated systolic hypertension, and it's extremely common. Number 2, your diastolic number, your bottom number, goes down because stiff arteries snap back more quickly between beats. The bottom number, your diastolic pressure, often drops. So you might see 150/68 or 146/65. This is normal for older arteries. Number 3, your blood pressure sensors weaken. Inside your neck are tiny pressure sensors, and they're called baroreceptors. They help regulate your blood pressure when you stand up or change positions. After age 60, these sensors slow down. That's why standing too quickly might make you dizzy or lightheaded. If we push your blood pressure too low, these symptoms can get even worse. Number 4, your kidneys and medications respond differently as you age. Your kidneys clear medications more slowly, your liver processes them differently, and your hydration levels change faster. This makes older adults more sensitive to blood pressure medications. It also explains why your pressure may swing from high in the morning to low at nighttime. Your body simply reacts differently than it did in your 30s or in your 40s. Remember those days? How to lower your blood pressure naturally. So let's talk about something even more important than medication. This is very important to me. Non-pharmacological, natural strategies can lower your blood pressure. And this can lower your blood pressure just as well as medications can. I always tell my patients, you gotta move, you gotta move, you gotta move. Lifestyle first, medication second. And here are 10 strategies. Yes, I'm going to go through 10 different strategies that can make a big difference. Okay, so number 1, lower your sodium intake. This is the single most important natural step. Cutting sodium often drops your blood pressure by 5 to 7 points, sometimes even more. The biggest hidden sources are bread, canned soups, sauces, deli meats, and watch out for restaurant food. The goal is less than 2,000 milligrams a day. Number 2, increase potassium. So potassium is like a counterbalance to sodium. It relaxes your arteries, it helps your kidneys, it flushes out excess salt. Foods rich in potassium include bananas and beans, spinach and tomatoes, lentils and potatoes. And if you have kidney disease, please talk to your healthcare provider, to your doctor first. Number 3, follow the DASH or Mediterranean diet. These diets are backed by very strong evidence. They can lower blood pressure by 5 to 11 points. So think whole foods, vegetables, olive oil, beans, nuts, and fish. Number 4, walk every day. You don't need intense workouts. You don't need a gym. You don't need to run a marathon. Just walk 20 to 30 minutes a day. Can lower your systolic pressure by 5 to 8 points. Number 5, maintain a healthy, steady weight. You don't need large weight loss. Even 5 pounds, 10 pounds can make a noticeable difference in your blood pressure. Number 6, limit alcohol. Alcohol raises blood pressure through dehydration and hormonal changes. Less is always better for your blood pressure. Number 7, improve sleep, especially sleep apnea. Sleep apnea is a hidden cause of stubborn high blood pressure. If you snore, you wake up tired and fatigued, or you have morning headaches, you may need a sleep study. Number 8, reduce stress. This is probably easier said than done. Chronic stress raises blood pressure significantly. Here are proven methods: deep breathing, meditation, Tai Chi, yoga, all of these help. Just 10 minutes a day can shift your numbers. And number 9, stay hydrated. Dehydration raises blood pressure by tightening your arteries and increasing sodium levels. Small amounts of fluid throughout the day help keep pressure steady. And number 10, avoid the substances I'm going to talk about because they can raise blood pressure. And these include certain medications like NSAIDs like ibuprofen or naproxen, and decongestants like Sudafed, and certain herbal supplements, and excess caffeine, and high salt restaurant food. So now let's say you tried different modalities and nothing's really helping. Then maybe your healthcare provider will suggest medications, but then be careful about medications and be educated about medications. These medications can help, but make sure you work with your healthcare provider, work with your doctor, and use them carefully and gently. Best medications for older adults. Here there are calcium channel blockers like amlodipine or nifedipine. These are great for stiff arteries. But watch out for side effects such as edema, ankle swelling. Then there are medications called thiazide diuretics. Examples would be hydrochlorothiazide or clothalidone. They're very effective. They reduce fluid retention. However, your doctor may need to monitor your sodium levels and your potassium levels once in a while. Then there are ACE inhibitors and ARBs. Examples would be lisinopril, losartan, valsartan, and these medications can protect your kidneys and your heart. One of the side effects of ACE inhibitors is a cough. So if you're interested in a detailed look at lisinopril and side effects, click right here. Then there are other medications called beta blockers. Examples will be metoprolol, carvedilol, and you can use these medications, especially if you have other comorbid conditions such as heart disease, arrhythmias like atrial fibrillation, or heart failure. Now, what should you watch out for? There are 3 important warning signs that your blood pressure might actually be too low. Let's go through them. Number 1, dizziness when standing. So if you stand up and you feel lightheaded, you feel unsteady, your blood pressure may be dropping too much. Number 2, morning readings under 110. If your top number is 95 or 89 in the morning, that's too low, especially if you're an older adult above the age of 60. Number 3, fatigue, cold hands and feet, or brain fog. These are all signs that your organs are not getting enough blood flow. Remember, we don't want low numbers, we want safe numbers. And if you want to learn how to lower your blood pressure without medications, this video will be of interest to you. Click on it, think your health, and have a good day.